Hi, my name's Jamie Ranse and welcome to this short presentation which will introduce you to some key concepts in disaster nursing, specifically for undergraduate students. To start off with, a disaster is defined as a severe disruption to the functioning of a particular community. From a health perspective, this means not only do we have an interruption to things such as roads infrastructure and telecommunications or power infrastructure, but from a health perspective, it means that we have an interruption to the health infrastructure of a particular community. Now, the second part of this definition is really important, whereby the ability of the community to manage the situation is so overwhelming that there needs to be additional resources from outside of that community to assist in maintaining the normal level of expected healthcare capacity. This is normally seen in national disasters and international disasters where people come from outside a particular jurisdiction to assist in the disaster response and help bolster the health capacity during that particular time. So how many disasters really occur around the world, and is this something that we should even be interested in as a nursing student? Well, annually there's over 380 disasters, a lot more than what I thought were occurring around the world. And interestingly, most of them occur within the Asia Pacific or Oceania region. So from an Australian perspective, quite close to home. They're expensive. The cost to help assist in the disaster and re-establish communities following a disaster is estimated at nearly $4 trillion per year. Nearly 200 million people are affected by disasters, and more importantly, to think about, this results in over 100,000 deaths per year. So I think from this we can establish that disasters result in a major health incident throughout the world annually. Now, nurses within communities may be affected by a disaster directly, or they may be assisting in the response to a disaster. So it's really important that we have a conversation about nurses in disasters, and on this occasion talking about, well, if you're a nursing student, what might that mean for you in a disaster situation? Here's a tropical island. We like tropical islands, don't we? So on this tropical island, there's nobody. At the moment, there is a particular risk and hazard associated with this island, predominantly water. A lot of the disasters that occur, natural disasters that occur around water. Flooding, tsunami, landslides, and so on occur as a result of water. But if there's nobody on this island and a tsunami occurs, it's not really going to be considered a disaster because it doesn't affect a community and it doesn't affect anybody. It's only when the water rises to a particular level that it infiltrates a particular island, if it was inhabited with people, that it becomes a disaster. Now, from a health perspective, it's only a disaster then if that island gets so overwhelmed and that community is so overwhelmed that the normal health services in that island cannot cope with the number of people who might be injured or displaced, therefore resulting in the need for people to come from outside of the region to assist. So at the moment, there's no disaster. However, there's a potential for disaster, and there's a potential that it may result in a health-affected disaster. Now, Australia's had a major response in health disasters across the globe. Internationally, every year, Australia sends teams to assist in disasters. This is an image from Bahnisch J in the 2004 Indian Ocean tsunami. And this is the after photo from after the disaster had occurred, and which wiped out large proportions of Indonesia and the Indian Ocean region. Millions of people were displaced. Hundreds of thousands of people died as a result of this. And this was one of the first major international disasters from which the world decided that there needed to be more done to reduce the risk associated with disasters. Australia itself has had many disasters. This here is an image from Cyclone Tracy back in the 70s. And since then, we've had many major disasters. Maybe not disasters which have influenced or affected the disaster health of people on a major scale. And my example would be from the 2009 Victorian bushfires, whereby the disaster initiated a major response that the trauma centres, and in particular the burn centres, were cleared out of patients to allow for incoming patients from the disaster. But what occurred was that most of the patients that arrived for health services had minor injuries, and unfortunately those people who were expected to come to the burn centres and the major trauma centres died prior to arrival. Now, not to say nobody arrived at the trauma centres and burn centres and weren't revived and are fine. There are some of those people, but the majority of people either died or had minor injuries as a result of disasters such as the bushfires. Now, as a nursing student, this is you at university and you're studying hard, and there is a chance, as I've said before, that you may end up in a disaster. Now, there's a few things which you need to know or could expect from a disaster, and there's a few things that might occur within your School of Nursing. I've listed some papers here which may be of interest to you. One is a discussion paper about what's the role of nursing faculties in a disaster. Well, one role is that if a disaster happens in a local community and the hospital and health services are overwhelmed, normally universities are well equipped with health and medical supplies, beds, IV pumps and other adjuncts to help with patients in a simulated environment. Well, in fact, these can be used in a disaster situation, and it may be that low acuity patients from the health service are transported to a university for the purpose of monitoring and caring for patients in a low acuity environment to make space for higher acuity patients at the tertiary referral centres. That's one possibility, and that's occurred in some instances overseas. Other possibilities are that nursing students themselves may be caught up in the disaster. You may be on a clinical placement within the hospital at the time of the disaster occurring. You may have just finished a clinical placement at a hospital where a disaster has occurred. If this is the case, it may be that you assist in a disaster in the environment in which you've been undertaking your clinical placement. Let's face it, you're familiar with the environment. You know where things are in the ward or the department that you've been working on. And whilst the nurses who are fully credentialed to be a nurse can work in those environments and assist, you could also do some other tasks such as restocking items, doing basic observations for patients, doing some basic documentation, and helping out in those environments if a disaster occurs. So whilst you're on your clinical placement, ask to have a look for the disaster manual for that particular area to familiarise yourself with what might occur in a disaster if it happens. Now, nursing students might not be written into the disaster plan because they might not be thought of being used in a disaster or available for a disaster, but the reality is you're going to be there and you're going to be amongst it if one occurs, so you should become familiar with what it's like. Now, the other thing to think about is your education and training to then be in a disaster. There was a national survey done of all the universities in Australia to determine what level of education and training was provided to undergraduate nursing students in terms of disaster. And surprise, there's very little. Very little lectures such as this or short seminars, and very little content or unit outline specific learning objectives related to disasters. Thirdly, we went looking for aspects in relation to, well, if it doesn't occur in an undergraduate level, what do you have at a postgraduate level? So we did some research in looking at postgraduate courses for emergency nurses, thinking that emergency nurses would have some educational training in disasters. Well, it happens again that the education and training that exists in the postgraduate space is very limited. Once again, there's no real life exercises, no testing of systems, and therefore it's often left to the individual to undertake study in relation to this area if it interests them. So who has the reliance then for the education and training of disasters for nurses? Often it falls back onto the health facilities to provide the education and training. But we know if we were to ask health facilities how often they plan for and do education and training in relation to disasters, again, it's not that often. It's the day-to-day activities, patients with chest pain, shortness of breath, the latest technology, the post-operative procedures, which dominate the in-service education calendars for most institutions. So, there's not much in undergraduate, there's not much in postgraduate studies. It's a reliance on the health facilities, But maybe if we prepared nursing students prior to them going from university to a disaster space and had them assist as casualties in major incidents or first responders in major incidents, it would provide some insight into what it might be like. I've spoken so far about not much education occurring. Well, the education that does occur may have a mismatch between what actually occurs in practice. So following the Victorian bushfires in 2009, we did a survey of nurses who assisted in the out-of-hospital environment. What we found was that nurses were most likely to have in the past undertaken education in things such as major bus incidences, major aeroplane crashes, and so on. But the reality of what they practiced in the Australian context at least, were bushfires and floods and cyclones. So there seems to be a mismatch around what we teach people in an educational perspective as to what practice actually occurs. Maybe we need to marry those up so that the education we provide to people marries up with what they're going to see in practice. And in this instance, what they see in practice, bushfires, floods and cyclones, we don't see too many chemical, biological or nuclear related incidences. Not to say that's not going to happen. And the other thing that we like to do often is give warning for when we do exercises, which is okay because we need to prepare people in the community that exercises are going to occur. But it does take away some of the reality of what it's going to be like for some people. The other thing that we do often is we will do single agency type of incidences. So here is some 2017 incidences that were mock exercises occurring in Sydney. I always wonder whether or not the local hospitals were involved, the emergency departments were involved, or if nursing students were involved in these incidences as well. So now we know a little bit about a disaster. Now we know that you may not have too much education and awareness of what a disaster is like. Are you going to assist? Well, it's a really good question, and we did some research around emergency nurses and their willingness to assist in a disaster. In 2009, there was a Samoan tsunami, and I walked around my emergency department at the time where I was a clinical manager and asked people if they'd be willing to assist. Overwhelmingly, people were happy to assist. But when we started asking questions about, well, what it's like going to be to assist, we started to get people put down their hands and say, well, maybe I'm not quite ready for that. And in our research, that was the case as well. People were willing to assist, but it depended on a few factors. The uncertainty of what's happening at home. Do you have children? Are you caring for partners? Are you caring for elderly parents or people with disabilities? Do you have pets that require care whilst you're at home? They were some factors which influenced people's willingness to assist in a disaster. Depends on what's happening at work. If people felt that their work environment, as in the emergency department, was a place of calm and control, and that people understood what their role was in a disaster and that the institution knew what it was going to do in a disaster, people were more willing to assist in a disaster as well. Depends on the information provided, and this related to the type of disaster. So, if it was a disaster which was a bushfire, flood or cyclone, people were more likely and willing to assist in comparison to if it was a disaster related to something such as biological, chemical, nuclear or respiratory of unknown cause related incidents. We found that people were more likely to want to stay at home thinking that that would be a safe haven and less likely of being infected or exposed to these incidences if they were at home. Now, interestingly, in Hong Kong following avian flu, what they found was that most people were more willing to go to work in the disaster. And that was because their healthcare facilities provided them with adequate infection control procedures and equipment. They actually felt more safe at work knowing that they were protected by the institution than they were if they were at home. So it's a story around preparedness and how you prepare people for disaster and give them perception that it's going to be okay to be at work. I've already mentioned that it depends on the team and who you're working with. If you feel comfortable around people and working with people, then you're more likely to go to a disaster as well. Now, the unspoken, and this is why we need to speak about it, because much of the disaster is unspoken. It's unspoken about what people's roles are going to be. It's unspoken about what people are going to do in a disaster. And as I've already mentioned, it's unspoken about what things nursing students would do in a disaster as well. And the last point there around a moral duty, most nurses felt that they had a moral duty in a disaster to assist in some capacity if they could, giving into consideration the factors above. Overall, the biggest theme that came out of our research was around making choices. There were so many choices that nurses made and nursing students would need to make if they were to assist in a disaster. And finally, even if it was about your willingness to assist in a disaster, one thing that you need to consider is about the ability to assist in a disaster. Often roads and infrastructure are cut, so you can't even get to work to help. So maybe you'll be helping in the local community with your neighbours and in the neighbourhood rather than at a designated site. I'm going to talk more about that in terms of disaster tourists and disaster tourism later on. Well, what would your role be? So you decide to assist in a disaster. What would your role be? Here is a picture of firefighters at a fire. Now, we think that firefighters at a fire are going to be putting out a fire. Well, may not come as some surprise to you after seeing images coming out of the 2009 Victorian bushfires that this firefighter was helping animals in a fire. So it made me think, well, what do nurses do? When we think of, well, what do nurses do in a fire? We think of them perhaps assisting with burns injuries and smoke inhalation and so on. So we did a survey of nurses and what they did in a disaster, particularly following the Victorian bushfires. What we found was that nurses were psychological supporters, coordinators of care and problem solvers following the disaster, with the clinical care being a really small element of what it's like to be in a disaster. So nurses provide small amounts of clinical care for minor type injuries and illnesses following this disaster, and spent a lot of their time problem solving and coordinating care. Nurses knew where a patient needed to go to and where they were currently. They were good at problem solving how to get a patient from here to the hospital. They were good at problem solving things such as patients arriving with no medications and needing to figure out, well, what is the medication that this patient needs and where am I going to get it from? What is this small white round pill that the patient takes 3 times a day that they don't know the name for, that their GP put them on for some reason that they don't even know, and working out what that was. But the majority of time, nurses were psychosocial supporters. That is, supporting people who have been directly affected by the disaster from a psychosocial perspective. Now, I've got a few stories to talk about in relation to this. And it comes down to that nurses become burdened with stories in relation to disasters. So particularly nurses who come from outside the disaster affected jurisdiction to assist in the disaster response. So here's a story coming out of Queensland whereby there were major floods in 2011 and a helicopter was flying past and looked down, and on the roof of a house there were 3 people, a daughter, a mother and a father. The helicopter man was winched down onto the roof of the house and said, well, we've got enough space to take 1 more person onto the helicopter. The parents looked at the daughter and said, well, you know, we've had a good life. If the waters rise and we get flooded and died, well, we want to save you. So they winched the daughter up onto the helicopter and the helicopter flew off. The daughter ended up in an evacuation centre where nurses saw her and spoke to her about this situation. She was obviously quite distressed. Well, it only comes to light 2 days later that the parents were picked up by another helicopter and taken to another area, and 2 days later were reunited. Another story comes out of the 2009 Samoan tsunami, whereby people were presenting to Australian doctors and nurses following the tsunami. And on this occasion, a nurse recalled a story to me whereby she was caring for a mother of a child. Well, in fact, the mother had 2 children. But when the tsunami was coming in, the mother needed to make a decision about what she was going to do. That is, would she hold on to her 2 children and get swept away from the tsunami? Or would she let go of one child, hold on to one child to enable her to hug a tree to save her and her baby? This mother made the decision to let go of one of her children to save 2 of them following a disaster. Now, nurses are hearing these stories all the time in relation to disasters and disaster response. In day-to-day activities within a health facility or in a health service, the nurse can share this burden of psychosocial responsibility. That is, they can call social workers and people from psychology to come and talk to patients. They can talk to their doctors and nurses nearby. But in the disaster environment, there's not the same type of resources to help with the psychosocial burden. So nurses take this on board and have very few people to share this with, perhaps even until they return home to their country. So that's a broad overview about catastrophes and what it might be like to be a nurse in a major incident. Other types of disasters, though, that we see are not so man-made as such. Things such as pandemics. Now, there was the 2009 influenza pandemic which occurred across the globe and made its way to Australia. It infected large numbers of people, and I've already spoken about some of the precautions that people can take in terms of being prepared for pandemics, in terms of infection control procedures and equipment and health facility preparedness and so on. I wanted to mention this one though, because this was interesting. This was in Canberra, that the emergency department opened up an influenza clinic next door to the emergency department. So anybody who presented with flu-like symptoms, rather than presenting to the emergency department and potentially infecting patients who were not affected by influenza, who were acutely unwell, they could go to this influenza assessment clinic and see independent from the hospital itself to keep other patients safe. This here is just the number of patients per day who presented over the period of the influenza outbreak to this clinic. This red line represents the number of patients who presented to the emergency department and influenza clinic over that particular period of time. And this one here is just to the emergency department themselves. So there was quite a jump here in terms of the number of patients that presented to the emergency department and the influenza assessment clinic. There are large spikes here in the patients that presented to the emergency department. And interestingly, these spikes occur early on during the week, potentially showing that people who had influenza-like symptoms were less likely to seek help on a weekend and were more likely to seek help during the week. So pandemics occur on a global basis. They occur frequently. As such, we have immunisations against most of them. All of them are undertaken in a similar fashion, and given that we have global transport in today's world, travel relatively fast across the globe, there is not much you can do in terms of stopping transmission on flights and so on, but when they occur in your particular region, there is some things you need to think about. You need to look after yourself to ensure that you're adequately protected from receiving the influenza or whatever the pandemic disease is of the time. And then you need to be sensible about your family, and then you need to be sensible about how you treat people and where you treat them, and it may result in a change in your practices to have that occur. Again, this is something where nursing students could help. If there were other influenza assessment clinics established, nursing students could most definitely help in that kind of context. Now, when a major incident occurs, resulting in multiple casualties at a fast pace, at a fast time, it may be appropriate to establish a triage process. Now, for those people who don't know, triage is about sorting people into their order of priority to do the most good for the most amount of people following a major casualty incident. Not only disasters, but any major casualty incident. This can include bioterrorism, terrorism in general. It could include bridges collapsing. It could include all the disasters which we've spoken about, a bus crash on the highway, whatever it may be that results in large numbers of patients all presenting at the same time. Now, there are different algorithms and ways to go about triaging people to do the greatest good for the greatest number. Now, on the day-to-day activities within the emergency department, the sickest people get seen first. Lots of people will help that sick person to try and make them better and ultimately have them return home in a normal functioning capacity. However, in a disaster, if we put a lot of human and physical resources into one individual to try and save them, we may result in a number of other individuals who don't get an optimal outcome in their health. So what I'm saying is that in a disaster, we do a thing called reverse triage. That is, the low acuity patients might be seen first, and the higher acuity patients might not be seen at all. Depending on the resources, depending on who's available to assist and in what capacity, depends on when that actually starts to occur. Now, in the Australian context, it hasn't occurred at a great deal at all. There are probably only a few incidences where this has occurred, such as Granville rail disaster, and maybe in relation to the provision of blood products following things such as Bali bombings. So triage is a concept. There's no right or wrong way to do it. It's about doing the greatest good for the greatest number of people. And I'll put some resources in the description below which link you to some more things about triage. Here is an out-of-hospital triage example where triage occurs multiple times at multiple sites throughout the patient journey. So the person's triage category or where they get triaged in what order may change. Here is a really simple way of determining if someone should be triaged at what category in a disaster. So if they're walking, yes, they can go and wait in a particular area and be seen at another particular point in time. Often the place for them to wait is not at the hospital. Try and keep them at the disaster site as long as possible, over in a corner somewhere, where you may have one or two people keeping an eye on them, but not really putting a lot of resources into managing that group of patients. Next is into your airway, breathing, circulation to determine if a patient is seen or not seen and in what type of priority order. Now, I've mentioned there's one way to do it. There's lots of other ways to do it depending on who you talk to and what categories they have and so on. It can get really complicated. So the key thing is to do the greatest good for the greatest number of people in a disaster situation. Go back and have a look to see what policies and procedures are used in your hospital or the health service in which you might be undertaking your clinical placement. Now, finally, I want to finish up talking about disaster tourism. And don't be a disaster tourist. So what I mean by that is, if a disaster happens, don't just self-present to help out in that situation. There's processes to be undertaken to ensure that you don't place an additional burden on the community that's already has a major burden from that disaster. Don't go to a disaster to try and help, because what occurs is an increased need on their infrastructure. Do you bring your own water? Where do you go to the toilet? Where is your food? And so on. Now, even in an Australian context, if a disaster occurs, don't necessarily just show up to the hospital or the health service where you're doing your placement to help. It's really important that it's undertaken in a coordinated manner, that people don't just turn up. In fact, you need to wait until you're invited to be in a disaster. The exception being, if the disaster is in your neighbourhood and you just happen to be amongst it at that particular point in time, that is fine, but don't go looking for it. Don't be a tourist, because you'll just end up in more confusion, more chaos, more burden for the particular community. I hope you found this informative and interesting as an introduction to disaster nursing for undergraduate students. Thank you.